Interaction of medicine and profit is another source of social toxicity. As famed novelist and political activist Upton Sinclair once said, health and medicine require the patient to be healed, but a patient healed is also a customer lost, reducing profits. Hence, there is an innate conflict between the motive of increasing profits and healing patients, which no amount of legal or moral gymnastics can overcome.
My parents didn't know what was going on, so we went to my physician, and then they got a psychologist. And so I met with the psychologist. I said, look, I feel short of breath, I'm anxious, I can't sleep, my vision's blurry, I can't stop shaking, and I just barely received my first dose of Moderna vaccine. What is going on? And they said, well, so then they talk about whatever happened in Dallas and insisted that the vaccines into that, and I was just I was a high candidate for bipolar.
Had you ever been diagnosed with bipolar?
No, just out of nowhere, I was a candidate for bipolar.
It sounds like they would do anything but acknowledge that there was a relationship between that first dose and all of these symptoms that were newly manifested. Now, how long until the second dose? What was the time frame?
Well, so before the second dose, still in a doctor's appointment, they tried to put me in a mental hospital saying I was crazy and that,
they tried to institutionalize.
Yeah, they're saying that you shouldn't lose your vision, you shouldn't feel anxious, you shouldn't not want to go out places, you shouldn't, cry while, shopping for groceries, and, you should be able to go to the bathroom at least once a day, taking,
Well, of course, everybody should do those things, but
a healthy person does those things, but not, not a sick person's not able to do.
And they knew your medical history didn't include any of these symptoms prior to that shot.
They just said it was your ADHD acting up, causing a bipolar disorder, and they just gave me 100 milligrams of sleeping pills.
This conflict was clearly expressed in a CNBC story about a report by Goldman Sachs, which asked, is curing patients a sustainable business model? The report also noted how curing patients reduces the spreading of the disease, hitting their all-important bottom line. With a systemic conflict of interest like this, we would expect chronic disasters, and they have sadly occurred for nearly a century. Let us look at some examples. Cigarettes, which Big Tobacco openly admitted could cause lung cancer after 45 years of litigation. Smoking was, at one point, even recommended by doctors, and the ads from the early 20th century show that clearly. A second example is PFOA, which was used to manufacture Teflon. The industry knew early on that this compound was dangerous, but once again, it took more than 25 years of litigation for that to be admitted in the open. And finally, radium, the famous radioactive material, was also touted to be a cure-all for years. The girls who handled radium in the factories came down with horrific damages, but it took 15 years of struggle for that to finally come to the fore. These examples can be multiplied by 100, and in each case, we see the tragic, poisonous result of an institutional conflict of interest. Any industry that is also in charge of the messaging regarding their product will downplay the dangers. Millions of lives have been silently lost in this struggle. However, the profit motive does not disappear by simply utilizing the nonprofit status. For example, in Utah, public disclosures of Intermountain Healthcare show that their top 11 employees earned a combined $25 million each year. Does this look like a nonprofit to you? There are also other so-called nonprofits like Utah Medical Association, Hospital Association, and other associations which also have strong ties to the industry. Not one of them urged any caution with regard to the COVID vaccine. The connection between physicians and the industry is so strong that even the AMA points to it in a journal article, wondering if a gift is ever just a gift. And a Wall Street Journal carried an article by doctors concerned about the influence of drug firms on their own profession and associations.
Things have changed tremendously in terms of what you knew to do or thought was a standard of care scenario that had been altered.
The main thing that changed was that we were not able to talk about things that could prevent and cure the disease. I always thought that we could keep looking outside the box. It's really pushed on us that we need to use evidence-based medicine. It took me many years to realize there can be a little problem with this theory of just using what they're calling evidence-based medicine. And yes, we need evidence. We need to have treatments that are likely to help. We certainly don't want treatments that will hurt people, and it's good to have evidence. But what you realize, this evidence-based medicine idea is really, it's coming from a baseline program where you have to have money to test. Usually it's one thing that you test.
So here's the insider's view. So Marcia Angell said it is simply no longer possible to believe much of the clinical research that is published, or to rely on the judgment of trusted physicians or authoritative medical guidelines. And again, this is the former editor of the New England Journal of Medicine. So this is an insider who spent decades working at evidence-based medicine, saying that evidence-based medicine is actually so corrupt as to be useless or harmful. This is basically what she's saying, and she reached this conclusion only after several decades of being in it.
Pandemics really are times of opportunity, and I like George R.R. Martin's quote of chaos is a ladder. I wanted to give you good news. There are winners out there, right? So if you want to be prepared and make money in the next pandemic, if that's what you want to do, buy stock in hazmat suit makers and protective clothing, or companies that make antiviral drugs of that particular pandemic. You'll probably do pretty well. There are actually mutual funds for pandemic preparedness. You can bet on anything in this country.
We have seen how the profit motive affects the medical field. In the last 3 years, how did the industry in general affect our personal medical decisions? Economic persecution was pursued by saying, no jabs, no jobs.
The new wild card is full FDA approval now. So now, what do you think? What would you urge companies to do? What are they going to be able to do, and how should they do it?
Companies can now very comfortably move to mandate the vaccine. They have some legal leverage if that's an issue.
This isn't about civil liberties or individual choices. It's about the policies companies need to keep employees and their families safe. And this isn't just a Google thing. Facebook said yesterday that they're going to mandate vaccines for a return to the office. Netflix is mandating vaccination.
Disney joins a growing list of employers who are mandating vaccines in order to return to work.
Locally in Utah, a quick search on Indeed.com for jobs shows that the no jab, no job policy is still alive and well, even as of the fall of 2022.
And so they told you if you didn't take the injection that you would not have a job. Is that correct?
That is correct.